is Parkinson's Disease Awareness Month, and Medtronic is commemorating with their commitment to continued advancement of deep brain stimulation therapy. Parkinson's disease patient Andy Horn and neurologist Dr. Okanis Val join me now to discuss the latest in DBS technology. So thank you both for joining us today. Can you first, though, tell us about movement disorders like Parkinson's disease and how they actually impact patients?
Yes, good morning, and thank you for having us. So, movement disorder, Parkinson's disease, is a neurodegenerative disorder that affects movement, causes tremor, it causes slow muscles, and affects walking and coordination. So, overall, it affects the patient's quality of life. They're not able to do things they used to do, enjoy their hobbies, their families, travel, things like that. So, we do have plenty of therapies for Parkinson's at this point in the form of medications, but also devices such as deep brain stimulation.
Yeah, so let's talk about that. What exactly is it and how does it work?
So deep brain stimulation has been around since 2002, so it's not brand new. It is similar to the cardiac stimulator. Or pacemaker, it is the pacemaker of the brain. So we do see that this device delivers electric signals to the brain, specifically in some targets that are being placed by neurosurgeons. And this electrical stimulus, so to speak, corrects an incorrect circuit that is there because of Parkinson's disease. And by that, we see that it improves and treats symptoms of movements such as tremor and stiff muscles, slow movements, and this improves quality of life for the patients.
Okay, well, let's talk to you, Andy, about what your experience was like before this treatment and how you're doing now after.
My experience before the treatment was pretty bad, actually. I got right before I got the DBS surgery, I was up to about 40 pills a day.
Wow.
And all the side effects that go along with that. As far as like diagnosis and all that, I was diagnosed in 2015. But I started feeling a lot of the symptoms about 2 years prior. Started with lack of an arm. When I was walking, my arm didn't swing anymore on my right side. I was having trouble brushing my teeth. I was having difficulty buttoning my shirt. And so those are a lot of things that prior to DBS that I just wasn't able to do without some assistance either from my wife or whomever was around. Even cutting my steak, for that matter, was difficult. And now today I'm at a point where the DBS is pretty much gave me my independence and autonomy back.
That's wonderful. I'm so glad to hear that. Well, where can we go for more information? Because I think this could help a lot of people.
It sure can. So in terms of information, there's plenty out there. However, you need to go to more credible sources to get the right information. The foundations are the right sources to go to, such as Parkinson's Foundation or Michael J. Fox Foundation. There's also the American Parkinson's Disease Association. So in general, large foundations that are dedicated to treating Parkinson's. There you can find resources and information on Parkinson's disease, different therapies, different clinical trials, deep brain stimulation, and anything that involves Parkinson's.
All right. Well, thank you again, both of you, for joining me today to tell us a little bit about your story, Andy, and how Medtronic is helping, because I think that sounds so amazing. And everyone at home, if you'd like to see this interview again, you know you can head to First Coast News Plus.